Good morning, honorable members of the Pharmaceutical Society of Kenya who've joined us today, our guests from other cadres, our distinguished panel of speakers and moderators. Ladies and gentlemen, my name is Daniela Munene. I'm the CEO of the Pharmaceutical Society of Kenya, and I'm very glad to be your host for this edition of Pharmacy COVID-19 Dialogues, where we talk about what pharmacists in different sectors and different stations are doing to respond to the COVID-19 pandemic. It's a peer-to-peer discussion, and feel free to interact with the panelists as much as possible during this webcast. For now, I'd like to introduce you to the moderators who will take us through the program for today. We have two moderators. Dr. Michael Mungoma is a member of PSK, and he's also the Dean of the School of Pharmacy at MKU, that's Mount Kenya University. He's also a member of the PSK NEC, and he's a member as well of the PSK COVID-19 Response Task Force. Karibu sana, Dr. Mungoma, please say hello.
Good morning, everyone. Good to be here.
Thank you, Mike. Our second moderator is Dr. Sylvia Opanga, who's a member of PSK. She's also a senior lecturer at the School of Pharmacy, University of Nairobi, and she's the chair of the Education and Public Health Committee of the PSK COVID-19 Response Task Force. She's been a teacher for many of us on this webinar, I'm sure. Karibu sana, Dr. Opanga. Please say hello to the participants.
Good morning, participants, and welcome to today's webinar.
Thank you very much. So I'll hand over to Dr. Mungoma and Dr. Opanga. Over to you. Please take us through the program.
Good morning once again, participants. Before we start, we have a few ground rules and announcements. You'll all be muted during the entire course of the webinar. Please ask questions via the Q&A tab at the bottom of your window. Now, don't field your questions in the chat tab because they will not be responded to. These questions shall be addressed by panelists later in the program. For PSK members, if not already done so, please subscribe on PPD portal for today's webinar to get your CPD points. For PSK members, kindly note that CPDs will be awarded to paid up members only. This webinar is being recorded and the audio will be made available on PSK's YouTube page. I'll start with introducing our speakers. Our first speaker is Dr. Mandeep Soki. She's a proprietor of CityMed Pharmacy. She's a pharmacist with over 13 years experience in regulatory affairs for pharmaceutical companies and is now in community pharmacy since 2015, running her own pharmacies. She has assisted with drafting the COVID guidance for community setups and distribution practices. Our second speaker is Dr. Peter Nguhio, and he is a pharmacist and a health economist, currently pursuing his PhD studies at the Kemri Wellcome Trust Research Program. He's a member of the PSK COVID-19 Task Force. He was involved in drafting the COVID guidance for retail pharmacies, and he's also popularly known as Caris, and my classmate from a long time ago. Welcome, both speakers.
Hi, everyone. No, thanks.
So I will go to the agenda of the day. We'll start with Dr. Mandeep, then Dr. Peter, who will be talking about community pharmacy response to COVID-19, after which we will have a Q&A session. So I would like to move, next slide please. I'd like to move to now the speakers, hand over to Dr. Mandeep to start. Thank you very much.
Thank you, Doc, for the introduction. I'm really happy to be here, and I hope this will make an impact to everybody. So we're going to talk about responding to the COVID-19 pandemic, a community pharmacist response.
Dr. Mandeep, you're not clear. Sorry, you're not very clear. You might need to project your voice. You might need to project the voice.
Can you hear me now?
Yeah, that's better.
Okay, thank you. Good morning, everybody. Thank you for attending this webinar with regards to responding to the COVID-19 pandemic, a community pharmacist response. Next slide, please. So the outline we'll be looking at are the principles of patient-centered pharmaceutical care, which is home-based practices, and the effects of COVID-19 on community pharmacy practice. Next slide, please. So I'll hand it over to Dr. Peter to take over the home-based care and the patient-centered pharmaceutical care.
All right, thank you very much. So in this section, we'll want to just talk about the principles of patient-centered pharmaceutical care and focusing mainly on what changes have or what principles have been highlighted by by COVID-19 situation in the country. I know there are very many principles that you've come across in training and even in your reading. And I thought to talk about 4 key principles and how these have been impacted or have been brought, have been expressed more with this situation that we are in right now. So the first thing is about clinical history taking. We all understand that it's really important, it's really critical for a proper clinical history to be taken and to be recorded for patients when dealing with patients at the retail pharmacy level, at the community pharmacy level. It's really important to identify concomitant risk factors. And we have seen this playing out really critically now, because as we've learned over time, the trajectory of COVID-19 infection is different for different risk groups or risk subgroups. Looking at patients who are above 65 years old, the risks and the prognosis are quite different from patients who are less than 65. We've seen that patients with concomitant chronic diseases, such as diabetes, such as cardiovascular diseases, and now even some with renal complications, seem to have a different prognostic pathway compared to others. We don't know much about the effects on pregnant women. We don't know much about the long-term effects of the infection on other certain subgroups. So it's really important at the clinical, at the retail pharmacy level, to have a good record of clinical history of patients, so that you can be able to quickly tap onto any potential risk factors and to advise accordingly. The second principle is around medication use counseling. And we have always talked about how important it is for us to provide clear, well-labeled medicines and accompanying medication use counseling, so that the patients are able to adhere to the correct regimen of treatment. This is not just with regards to COVID-19 treatment, but with regards to all kinds of treatment. But what we have seen with COVID-19 is that it's really important for patients to understand what works and what doesn't work. Being a viral coronavirus infection, and being a viral infection, generally we don't see much role of various treatment regimen, but there's a lot of rumor, a lot of speculation around what works and what doesn't work. So it's really important at the retail pharmacy level to provide clear information about medicine use. You might find patients coming in to ask about whether this works, whether that works, whether this herbal concoction works, whether that traditional method of treatment of fever works, and what should be done. So it's really important to provide clear information and counseling. And so that's why the pharmacy guidance includes a section on home-based care, where we expect that retail pharmacy and community pharmacy practitioners can provide consistent information, standardized information about what is known to be effective. So especially around treatment of fever, treatment of coughs and sore throats, and further on to do with continuous monitoring of continuous self-monitoring to detect any exacerbations that require a quick referral to a testing site or to a hospital. So it's really important to keep in mind that. And then the third and the fourth principles around active surveillance of adverse events and control of irrational use of medicines also ties in with this issue of medication use counseling, where we know it's an important role, it's a critical role for retail pharmacies to play the control role, where you don't encourage irrational use of certain medicines, antibiotics, for instance, pain medication, for instance. You see, there's a point where there was a bit of a discussion around use of ibuprofen in management of fever and inflammation associated with COVID, and all of a sudden people were going and accumulating a lot of doses of over-the-counter ibuprofen, which we really do not have much evidence about, and even about irrational use of medical devices, and we've seen that happening. So as we head towards a point where we'll be doing antibody tests, it might be important for us to keep the principles of rational use of these products, knowing that these are resources that are constrained. And we shall also continue doing active surveillance, finding out whether any adverse events are being reported when using the regular medicines that our patients are on, chronic care medicines, for instance, whether we are finding any changes in, for instance, management of a steady level of glucose for those who are diabetic. Those are early signals of need for referral and more more careful monitoring for such patients. Next slide, please. And so, as I've mentioned before, in the pharmaceutical guidance provided, we've had a section that talks about home-based care and just really highlighting symptomatic management and what we know about management of fever, management of sore throat, management of coughs, handling general fatigue for people who have a diagnosis of COVID-19. We have touched on the role of non-pharmaceutical therapy. So, and this is basically in line with national guidelines on management of COVID-19. So things like taking bed rest, things like isolation have been mentioned, but these are really explored more in the national guidelines. And the important role that retail pharmacy has in identifying worsening symptoms. So this is mainly what I was talking about around the principle on monitoring adverse events, and even on medication use counseling, giving information so that the patients can find they're empowered to do self-monitoring. Okay, next slide. Just to mention that one of the changes that COVID-19 has brought about that retail pharmacists have had to think about is the ability to do home delivery, purely because of the need for isolation of these patients. So the role of the retail pharmacy in ensuring that there's continuity of medication use involves thinking about innovative ways of delivering medicines to people in isolation. And so pharmacies are encouraged to, if they're able to extend their services to patients who are in home quarantine or in isolation, to ensure that there's continuity of pharmaceutical care. And also to patients who belong to high-risk groups. We've mentioned a few of those high-risk groups before in the presentation. And also for patients who have reduced mobility in general. we encourage that pharmacists should consider ways of doing home delivery of medicines, but without compromising on medication use counseling and on the regular monitoring and control of the use of these products. Next slide. So the next slide shows a picture of people delivering medicines to a patient at home, and you can see that this is it's being done in a way that ensures that the people who are at home can identify where or who is delivering the medicines, or whatever the package is that's being delivered. They should be clear about who is, where it's coming from. They should be clear about what's being delivered, and the fact that this is these are pharmaceutical products. Therefore, they should not be left in a place where they will be exposed to conditions that might diminish the quality of the product. They should also maintain it's actually 1.5 to 2 meter distance between the person delivering and the person receiving, and perhaps even considering methods by which you could have these products dropped off at convenient locations, depending on where or what the delivery mechanism is being used and where this is happening. And there should also, it's also recommended, if you check in the next slide, please, it's also recommended that we follow up via phone call with the patient to ensure that these patients have received their medicines and that there are no medicine use concerns. These products need to be well labeled. They should be, it should be very clearly explained what the patient should do with these medicines, even if these are patients on continuous medication. So if it's regular patients getting refills of their medicines, it's really important to still have proper labeling and instructions, and to follow up via phone call with the patient to ensure that there are no medicine use concerns. All right, so I'll hand over to Dr. Mandip for the next part.
Thank you, Doc. I hope everyone can hear me. I'll take over the effects of COVID-19 on community practice. Next slide, please. So in this, I'm covering both for the retail pharmacy and the pharmacies in hospitals. And these are the protective measures which need to be taken. One is the personal protection, which is the use of face shields, surgical masks, while serving the clients. Now, we all know that there's a lot of surgical masks around, and we need to know that the ones we're using are safe for us to use against the COVID-19, which comes down to which masks are we using. They should be fitted tightly on the face, and preferably the N95 type, or at least the 3-ply ones. With regards to overall hygiene, there should be frequent hand washing, sanitizing before attending to each patient or client. And the last is the clinical waste management, which is, of course, organizing your bins and having a suitable collection person or company who will deal with the collection of the waste management. And I think all the waste management companies currently know how to handle the COVID-19 packages when they're picking it up. Next slide, please. So these are the preventive measures to be taken up by pharmacy managers. The first one I'll take up is the development of emergency plans and workflow. This comes down to having your standard operating procedures in place for a COVID-19 pharmacy, and how the workflow should be done within the staff. These standard operating procedures should entail each and every aspect of the workflow of a pharmacy, from sanitizing your hands, washing, wearing your mask, and how to attend to each client. And of course, in a very polite and possible way, to tell the patients to also maintain their distance, the social distancing within the pharmacy and from the staff. Second is to carry out full staff training with regards to the COVID-19 and how to deal with the patients. And again, this will be part of the standard operating procedures where the managers should train the staff as to how to deal with any patient coming in, for instance, if they have a cough or a cold, and what sort of questions they need to ask them, where they've been, where they've traveled, how long the symptoms have been there, and or any other questions which the pharmacy manager may seem appropriate for their pharmacy situation. The next, which is very important, is to assess the health status of the pharmacists or the clinicians working within the pharmacy. And this should be done on a daily basis. And whereas each pharmacist or personnel working within the pharmacy needs to actually go to the pharmacy manager and report, even if it takes 2 minutes, to say how they're feeling, if they're overwhelmed, are they not feeling well, do they have a sore throat, and it's for the pharmacy manager then to assess what are the next steps to be taken. Number 4 is to protect the pharmacy personnel, which is of very high importance. Now, how the protection is done is, of course, you have a sanitizing place outside the pharmacy where any client, any patient coming in will sanitize and either wash their hands or sanitize before entering the pharmacy premises. If it's within the hospital, all hospitals have the sanitizers available at every point. The other way to protect the pharmacy personnel is to have shields between where the patient stands and where the pharmacy personnel are going to assist these patients. And of course, they need to wear their masks and their gloves while serving the customer. Number 5, to strengthen the pharmacist's infection monitoring. Again, this comes down to reporting every morning whether how the pharmacists are feeling or the pharm techs are feeling, and keeping a record of this on a daily basis. I know it gets overwhelming on a daily basis, so it could be done maybe every few days, but it is essential that it's done every day because we don't know where they've been as well and how they've traveled. So it's a good way to keep a measure on this. Next slide, please. Next is, of course, ensure adequate cleaning and disinfection of the management areas, which is your surfaces, the desks, any equipment being used. They need to be disinfected at least 3 to 4 times a day, or when your busy period is over, it needs to be done immediately. Strengthen patient management and education. This can be done by using flyers, putting up posters, any sort of information you can give patients on COVID-19. You could even, what we've done is send out messages to your regular clients, updating them on any information coming up. And patient management comes down to keeping their records, keeping a record of who their GPs or their doctors are, what their current status is, what current medication they're taking, and following up on somebody who's probably had COVID-19, and obviously the pharmacy manager would know it, or the pharmacy staff, and follow up with phone calls and see how they're getting on. And this is what we tend to do in our pharmacy. Number 8 is to retain adequate patient information. In hospitals, this is easier. In retail pharmacy, it gets a bit difficult because some patients somehow don't want to share all the information. But mostly now, because of the COVID-19, we've seen they've warmed up to the idea, and they give you the information such as their age, their sex, the current medication they're on, their doctors or their GP's contact information, their travel information, are they going, are they coming, anyone else in the house who may be having a cough or a cold or any symptoms. So you just try and retain that sort of patient information. Strengthening the infection exposure management, again, that comes down to wearing your face masks and having the shields, protecting yourself, sanitizing, keeping the social distancing. So usually in pharmacies, they put on the floor stickers to show the 1.5 meters distancing. And we just need to be polite enough to make sure all patients and anyone coming to the pharmacies understand why we put that, and they maintain the distance. Again, strengthen the medical waste management. This again, have your special bins in place and have a proper waste management collection team or company, which the Pharmacy and Poisons Board have a list of, and they will come and collect it because they know how to collect the waste and how to also dispose of it. Next slide, please. So health products and technologies. Quality assurance for products in demand such as KN95 surgical masks, gloves, disinfection materials. They need to be clear supply lines. So within your pharmacy practice, know exactly where each and everything regarding these health products, where they've come from. Keep all invoices, anything, any payments going out, any payments coming in. So traceability is very important. How do you trace these? You should have a proper system in place on your computer. There's a lot of systems available. The one we use is Pharmacotherapy, and so traceability is very easy because you can actually put in your batch numbers, where it's come from, the supplier, who it's being sold to, and obviously forecasting becomes easier because let's say you order 100 of KN95s and you see within 2 days, well, you're using 70 masks. So for your forecasting becomes really important as to when and where to order again. And supply planning, again, that comes down to you just assess on each product the input and output. Again, price controls. We know as a retail pharmacy, price controls, when this thing all started in March, overnight the pricing went up. There is actually no system in place for the price controls currently. However, we do have a price list from the pharmacy which we can share for anyone looking for any sort of pricing on any of the products. The rapid testing kits at retail pharmacies, it's still an expedited study, not yet approved. I know some of the laboratories are doing it, and likely we're waiting for this to change soon. So there's an implied responsibility for referral and documentation in line with the MOH guidance, and the MOH guidance is available online. You can download it from the MOH website. Implied added responsibility for contact tracing. This is, of course, if, let's say, a patient has come in and you consulted their GP and the GP has confirmed that that patient has had COVID-19 or is positive for COVID-19, you can be responsible for the contact tracing, and because that patient is somebody who probably regularly visits your pharmacy practice, and you can actually politely ask them if they can share the information where they've been, if they've been in contact with anybody else, and hopefully they will warm up to the idea of giving you the information. Lastly, the implied added responsibility for identification of concomitant factors. This comes down to the risk factors. Basically, let's say a COVID-19 patient has come into the pharmacy, he's later after 2-3 days seen to have been tested positive. And in this scenario, what we would do, as what my opinion would be and what we would do at our pharmacy, is to obviously close down for 14 days. And in this closure, then we can know which staff was infected, and then open after the 14 days and continue as per the guidelines given by the Ministry of Health. Next slide, please. So the future vision of community pharmacy practice, I'll hand it over back to Dr. Gurio. I hope all this information has been of use to those in the participants panel. Thank you.
All right, thank you very much. So as we said, the situation, the COVID-19 has presented challenges and opportunities for retail pharmacies and for community pharmacy practice to re-envision the way in which the practice is organized. Some of this has, has already happened. Like you can see, the previous picture we used to have of pharmacies. I deliberately chose not to put a picture of downtown pharmacies in Nairobi, but the previous picture of crowded pharmacies with people, picking out things from the counter with a small grilled window somewhere and people just serving out and guys lined up seems to have changed because, right now what we are seeing based on the guidelines of proper retail practice is that you need to have, adequate distancing, social distancing, and we need to have an ordered patient flow. I need to have, cleanliness and hygiene really maintained highly. And so we've been presented with an opportunity to revise the way we see clinical practice to be more in line with the standard of clinical pharmacy practice. And if you see in the next slide, a couple of thoughts about what are the opportunities, what are the positive changes that have been driven by this situation that we really need to acknowledge and adopt and encourage other even, retail pharmacies as they're setting up to really put this in mind. And one is about preserving the dignity of the clients. So what we are seeing is the reorganization of patient flow, the insistence of, of hygiene and spacing, and basically just, a way of ensuring that there is privacy in the dispensing of medicines, which has been enforced right now by the need for social distancing, but ideally should have been there and needs to be maintained even more because this is part of what we consider good retail pharmacy practice. Medication use counseling is becoming more, there's a higher onus or a requirement for retail pharmacists now to really ensure that our clients actually learn and they use the products much better and adhere to the products that they're dealing with. There's more focus now on the patient rather than on moving the commodity, right? Because as you've seen, it is very possible to shut down an economy due to a public health concern. And so now the issue no longer is about how the retail pharmacy survives. It's no longer about moving the product, but really more about retaining the client and ensuring that the clients are still there and able to get healthier and able to contribute better to the economy and so on and so forth. And we're also seeing this impetus towards pharmacy-related outreach services and client follow-up services, innovative ways being implemented in various areas. And so these are the kind of pushes that we think are positive or opportunities that have been presented by this situation. It's not all doom and gloom. Next slide. We thought to acknowledge the people who have contributed towards the work that we are discussing right now, but also just mentioning that if we do have to, if you do at the retail pharmacy come across a situation where you need to, reach out to the National Emergency Operations Center, it's important for us to have this information available. It's all about part of ensuring that we do our duty, our public health duty. And we just wanted to acknowledge that a lot of this content has been developed by the subcommittee that has been charged with case management and infection prevention and control, led by Dr. Yakub. And we really acknowledge that their contribution towards this content and the presentation, and also towards the development of the pharmacy guidance. And so Yakub was able to provide us with also the Mombasa County Preparedness and Response Center contacts. But I believe that almost all counties have point persons. And wherever you're practicing at, it's useful for you to try and get also the contacts of your county preparedness and response committees, so that we're able to communicate with them in case any need to report either diagnosis and also outcomes. As we look forward, as look ahead and start thinking about pharmacy-related or pharmacy-positioned rapid testing, it's going to be really important that you also have a mechanism for reporting this information that comes from the rapid tests, and also, referring patients and working within the national guidance. So it's really important that we actually are able to have this kind of communication with this team. Next slide should be the question and answer section. So let me hand over to the moderator.
Thank you. Thank you very much, Dr. Peter Nguhio and Dr. Mandip Soki, for that insightful presentation. There's quite a lot that pharmacists are doing out there to address COVID-19. We are all aware that this is a novel virus, and we seem to be learning something new every day, whether it's professionally or individually. And now go to the Q&A section. And I want to encourage everybody to send in their questions through the Q&A tab that is at the bottom of the screen as we address them. So Lucia Kipkoech says, is there any data indicating if our community pharmacies have witnessed increased demand for screening for diseases considered high risk in COVID-19, like diabetes or hypertension? So any one of you can answer.
So perhaps I would request Dr. Mandip to take that.
Okay, Dr. Mandip.
Thank you, Doc. There, according to my knowledge, no, there isn't any data indicating this for the screening of diseases. However, as you know, guidelines and everything is still they're still being developed, and once everything is done, we will definitely share everything through the PSK portal to all the pharmacists on this discussion. Thanks.
Okay, thank you, Dr. Mandip, for that. I have a question here again. Should delivered medicines be sanitized now that we are doing delivery?
Yes. So this is from my own basic pharmacy practice. What we do is before a package leaves the pharmacy, we sanitize it. And we have our well-trained personnel who are delivering the goods. Sometimes it's actually myself delivering them. And what we do is before delivery, yes, we do sanitize the packs right in front of either the security guards or in front of the person receiving it, so they know that we sanitize, and we've sanitized our hands as well, and we hand it over them. This gives them just that extra peace of mind that they're in a safe scenario within our pharmacy practice. I hope that's answered your question, sir.
Yeah, that follows up with a question here by Dr. Elizabeth. Is jig sufficient for surface disinfection? Should people have a bottle of jig in the house every time if home delivery services is their preferred option of accessing medicines? Because right now we are having quite a lot of reactions of people regarding visiting retail pharmacies, and those that are tech savvy, those that can access the internet, are using some of the resources that are out there. So is jig sufficient? Should people just use jig and water every time they receive medicines? Dr. Peter Nguhi would like to answer that question.
Okay, so I think the question is important, but I think there is a lot more to it than a yes no answer here, because you're thinking about different risk categories. So if you're talking about a patient who's just been diagnosed COVID-19, is in isolation, and you want to conduct hygiene and to do disinfection, yes, the guidelines actually state that you could use GIC, and they actually even stipulate the concentration that you could use for surface disinfection. So you could use, basically, instead of saying GIC, I could say sodium hypochlorite bleach, right? You could use hypochlorite bleach in sufficient concentration as defined in the guidance for surface disinfection. And for surface, we're talking about, like kitchen counters, door handles, the places where you expect that there'll be a lot of contact with individuals who are infected. So to ensure that the people who are in isolation are not likely to infect others via contact surfaces, etc., it's important that you use something like a hypochlorite bleach in adequate concentration. And also, for other lower risk situations, for instance, in restaurants, tabletops in restaurants, and chairs, and so on and so forth, there's also advice about what can be used. And all of these things are actually documented in the in various documents that are available at Ministry of Health guidelines. So I don't want to contradict any of the documents. But it's important that we don't go, overboard about that to result in this whole situation of what happened in the US and, recommending that people inject bleach, etc. And I'm saying this with a light touch. It's important that all this information be used, judiciously.
Thank you, Dr. Nguhiu. I think that's very important. And I think that's one of the issues that we normally have with COVID-19, which is effective communication. Dr. Yakub Sheikh also adds on to what you're saying. Although the virus has been shown to be viable on fomites, studies have shown the main route of spread of the virus is primarily through the respiratory route. Although we take extra precautions to sanitize at all times, it is good to know that the virus does not spread through touching fomites. Samuel Kerama asks, I hope this is the same Sam Kerama that I know. Good to see you. Thanks for the presentations. Kindly comment on one, what are the recommended trainings for pharmacy staff on COVID? Two, what is your view or opinion on fumigation of pharmacies or workplaces? Dr. Mandip?
Thanks, Doc, for the question. The recommended trainings for pharmacy staff, the training for the staff on COVID, there is a lot of trainings available online, which can be, it depends on your pharmacy setup. And currently I am actually working with PSK to do two things. One are the standard operating procedures, and also selecting which trainings we can use for the pharmacy staff. So in the very near future, I will share that with you. However, Samuel, if you want something immediately, we can have a chat about it. I don't have a problem. Attending to the second question, which is what is your view or opinion on fumigation of pharmacies and workplaces? All pharmacies, before you even start getting your customers in the morning, need to be cleaned. Yeah, top to bottom. The cleaning is done at the end of every day and at the beginning of every day. Now, if that is being done and that procedure is properly in place, and as I said, every 2-3 hours, again, sanitize the workplaces and do a quick wipe over where all the customers come in, place their foot, place their hands. If that is all in place, fumigation is not really necessary on a daily basis because you're doing that on your own. And that is what is currently working personally for us. I hope that that is sufficient what I've said, Doc.
Thank you. So I have another question here. How sustainable is home delivery as a sole way of dispensing? And this especially it is in reference to places that are not easily accessible or places that might have quite a bit of crowding, because we know that a lot of these home deliveries are done by motorbikes or other forms of delivery services. So in areas that are inaccessible, how sustainable is this? Because like I said previously, a lot of people are getting shy, partly because it's a fear of COVID-19, poor communication, and they don't want to come to the community pharmacies. So how is this sustainable? Either one of you can answer this.
All right, so I could try and take on that. My thoughts are, I think the question was about whether home deliveries as a sole approach for dispensing medicines.
Yes.
I think that is not sustainable for the reasons that I'm mentioning. Yeah. But
Yes.
I think the idea is to work on innovating ways of reaching out to patients. So if you're contrasting delivery using a motorbike versus not reaching the patient at all, then it's kind of obvious that it's best for the pharmacy to try and figure out the best way to reach the patient. But we're not saying that this is not going to completely replace the whole idea of visitors coming into the pharmacy, because there is value in face-to-face communication. There's value in clarification of information. There's even better security and so on and so forth. But we're just saying that it's the role of the pharmacist to figure out the best way to ensure that products reach patients safely. So I mean, I already say that this is a yes/no kind of answer also. But it's all about weighing what are the risks and what are the benefits of approaching using home-based delivery versus mandating or requiring that patients come to the pharmacy. And this is not just for the situation of COVID-19, but also even in future, improving access to medicines of a particular type or kind versus requiring that, controlling the use of these particular medicines still remains an area that I think will be in continuous development. Thanks.
Yeah. Thank you, Doc. Because I was actually reading something yesterday. I was listening to something, and what they're saying now is that our knowledge and skills in IT needs to be improved. And in fact, moving forward, this pandemic has taught us that education and knowledge on IT, information technology, is going to be mandatory. I think that was a very interesting word. They are mandatory, that every single person in the world will have to get some knowledge in IT, so that even the use of smartphones, the development of more apps, because the supply chain of medicines, I think, it has been impacted by this COVID-19. Now, George Otieno Gallo says, pharmacy professionals have a role to educate the public and not only customers on the safety and prevention measures. Is the use of posters, banners, and verbal doing media at the pharmacy sufficient? I think that just ties up to a question. Are the current communication channels effective? Dr. Mandip?
Yeah, I'll take that on, Doc. The thing is this, number one, that there's so much information available on the internet. So those who are actually tech savvy and keep reading and get all information from there, they're getting what they need to know from there. The posters, the banners, and the verbal is just, for example, I cannot be at every place to inform each and every person. So it comes down to the area and how in that specific area you can educate the people living around that area. And yes, that's where this use of posters and banners and the verbal media comes, it becomes sufficient. But overall, for the whole country, I'm not in the place to actually say what's being done for each and every person living in the country.
Okay. So another question here is contact tracing is something that is on everybody's lips, and we hear that a lot on TV, on radio, even written literature. Contact tracing. Is it something that needs to be? Is there an element of contact tracing in retail pharmacies? And the question would be: is it needed? Because some institutions, including banks, there are certain banks now, you walk into that banking hall and you have to key in your telephone number. And recently I went into a bank and I asked, what is this for? And they just said, this is just for, and I went straight and asked them, I'm sure this is for contact tracing in case of COVID. And the guy just nodded his head. Do we need to incorporate these into our retail pharmacies? And how can this be done without infringing on privacy? Because when people come to seek medication or they seek counseling, it's quite a private affair. How do we ensure that contact tracing is also part of our efforts as retail pharmacies or persons working in retail pharmacies or managing in fighting COVID-19?
I think I'll take that up as well.
Yeah.
It is mandatory to have some sort of contact tracing procedure in place. That's for sure. And yes, there's a lot of hesitation from certain patients who do not want to share that information. So what it comes down to is somebody very well educated within the practice to sit down with the patient, explain to them why we need this contact tracing done. And in my personal experience, I've not had anybody refuse to actually give me that information, because it's the way you convey the message to them and how important it is to contact trace. So somebody out there is not suffering or doesn't die from COVID-19. As for having any sort of system in place like what the banks have, it's costly. So I will try and look into it and share more information on it in upcoming webinars. But at the moment, I've not actually personally looked into that.
Dr. Peter, do you have any comment on that, contact tracing?
Just the general comment that the countries that have seen effective control of the spread of COVID-19 have generally been seen to implement very effective contact tracing mechanisms. So it's, I mean, from a public health point of view, I think it's necessary for us to really look at ways of improving our contact tracing mechanisms. We have seen certain countries implementing IT solutions for that. I think the UK has tried that. I can't speak about whether it was very effective or not. I think even Taiwan must have reported something about that. But I mean, this also, goes hand in hand with the considerations around trust, the extent to which the public trusts the healthcare workers with the information and so on and so forth. So it becomes really, it's not just it's more of a, it's a larger, more complex situation. And again, this also, it's important to also know that contact tracing is really useful in cases where infection is clustered, so that you can try and maintain, try and prevent the spread of disease from particular clusters to others. But if you have widespread community infection over a period of time, perhaps contact tracing might end up being much more expensive than just mass testing and wider kind of interventions at the public level.
Yeah.
Thanks.
Thank you for that, Dr. Peter. There's Dr. Elizabeth adds on to that and says most countries abroad, the EU and the US, have phone numbers on prescriptions as mandatory to follow up on medication use and reactions. And I think that's something to that can contribute towards contact tracing. And the word here is mandatory. there are certain institutions already, even in the country. Some of the restaurants you go to, I think one of them is Java, or I don't know which other one, where after you've done whatever you're doing and you left, you start getting prompts on your phone saying how was the service and so on. I think retail pharmacies might have to look into some of those, because some of our retail pharmacies, the way they are designed is such that they could be crowds. They could be very many people coming in, and depending on the sort of clients that are there, some of them might take 5 minutes, some of them might take up to 10 minutes sitting around on benches or standing there, or engaging whoever is working in the retail pharmacy. So I think it's one area that really needs to be looked into, so that retail pharmacies do not become a possible source of infection. Dr. Richard Gakunju says, how can we mainstream vaccination inoculation management within community pharmacy settings? How do we protect ourselves from being seen as overstepping our roles? Do we have policies that give pharmacy practitioners such mandates? Anyone could respond to that?
That's a heavy question, and I think perhaps that one we might even also ask the moderators to step in and mention about. But yeah, I mean, as we rethink the role of community pharmacy within the health system, I guess it's more about asking about the extent to which we are able to improve access to vaccination services, while still maintaining some sort of control over the quality of the vaccination, of the vaccines, and also of the delivery of the vaccines to the target clients, to ensure that you're able to monitor for adverse events, and able to keep track of to do proper active surveillance for those who have received the product. So I mean, think about it from the broader kind of view. I guess there are certain certain standards that need to be met for pharmacists to keep on doing the work of their work as vaccination centers. I know that there are some very good examples of that.
Thank you. I'd like to chip in on that one.
Yes.
So currently, the University of Nairobi does, every year in June, we train pharmacists on how to vaccinate. There are guidelines that are followed during the training, and then after that, we offer practical sessions. Now, within this training, we also involve the PPB, and they're actually quite in agreement that once the pharmacist has met those kind of conditions, they can be able to give vaccinations. And a few of the pharmacists who have been trained, like Nadia, are doing this in the community pharmacy. So this is something that can be done. I think the board has no problem with that, because as University of Nairobi, we've done this. We usually do this training in conjunction with University of Kansas in June every year. FIP also has guidelines on what pharmacists can do to provide vaccination, and the world over, pharmacists are known to be better providers of vaccines. In Kenya, this has been left to nurses, but you see, when you're vaccinating, you also have to look for anaphylactic reactions, drug interactions, and all those things, and even supply chain and storage of vaccines, which nurses may not know. So for us pharmacists, we are better off doing this. We are better equipped than others. So this is something that I would encourage pharmacists to take up and just come for the training, and you can see that this is possible. It's usually in June of every year. And then someone talked about contact tracing. One thing that pharmacists can do is stop seeing patients. They come over the counter, pick up medication, and they go away. You don't know who you've talked to, you don't know who you're seeing, and you don't know who you've given medication to. It's time that pharmacists must start record keeping, take the details of your patients, always for follow-up. And that could be very useful in contact tracing, especially for those you suspect have COVID-19. Thank you.
Thank you so much, Dr. Sylvia Panga. She is a clinical pharmacist. Dr. Birundu is also supporting what Dr. Sylvia Panga has just said and emphasizes on proper record keeping. Winslet Omuga says vitamin C is highly recommended now for the management of COVID-19. Is it purposely an immune booster or part of COVID treatment? Is it really needed or misused? Again, this could just be an opinion from either one of you.
Well, okay, yeah.
I'll
Dr.
say
Mandi.
something and then Dr. Peter can carry on with his comments. Vitamin C is actually just like an immune booster. It doesn't prevent, it does, I cannot claim this though, and I'll state that, but personally, it can't prevent it. It will just boost your immunity. So in the event you do get COVID-19, it will help you recover better, have possibly fewer, effects of the disease. But again, I leave to Dr. Peter to elaborate on that further.
Yeah, and all the information I've seen so far is that there is need for further study. So we can't really say what's the case. There's equivocal research findings around that.
Yeah, that's true. I think there's quite a lot of information that is coming out, and I think the overall, the main information is that the most important information is good nutrition. I think what has been confirmed is that if you have good nutrition, that impacts positively on your immune system. And since your immune system is connected to disease, then it is almost sort of inferred that a good nutrition, in addition to vitamin C, which has several other properties, could contribute towards overall improved immunity during this pandemic. Another question here is, there was I think part of the presentation talked about preventive measures by pharmacy managers assess the health status of pharmacists. Should pharmacists, pharmaceutical technologies, or other personnel in retail pharmacies be tested? How frequent do they need to be tested? And how meaningful or impactful would be the results of testing retail pharmacy personnel?
I think, Doc, in my opinion, first of all, in a setup, there should be the protection procedures which I outlined in the presentation, which is the masks, the shields, the sanitization, the social distancing. So that should be set up. Secondly, hitting on the testing of the pharmacy personnel. Yes, it depends from pharmacy to pharmacy. If the manager decides that yes, we want to do it, it can be done. It is a costly procedure to do it for all the staff, but if one is being done, all should be done. And I would say probably once in 2 months would be a likely sort of time gap to be doing the test for all the staff.
Dr. Peter, your opinion about frequency and meaningfulness of results following tests? Meaningfulness here, I mean, if somebody was tested and they were found negative, so what?
Okay, so again, this needs to be looked at from both the patient's point of view and the health system's point of view. For the health system, it really makes a lot of sense for up-to-date testing to know what happens in the population. But for the individual, it might appear as if it's an inconvenience, but I think it's also just a way of ensuring that people are able to keep to the, to keep themselves protected against exposure. And I want to qualify this a bit more and say that's my opinion. People who, okay, so anyway, generally testing, even for HIV, we just recommend that regular testing happens, and that one has, one minimizes the opportunities of infection, right?
Yes.
Protecting oneself from opportunities of infection. So it's the same thing again. We're also here from the individual's perspective, that one ought to prioritize minimizing opportunities of infection and keep track of whether they are infected, so that they can control. They can have a bit more control about the progression of the disease if they actually do get infected. The question of whether a policy should be put in place that people should walk around with antibody passports or something like that is another question altogether. And yes. I don't know whether I'm qualified to speak about that. Yeah.
Yeah, there's quite a lot going on, and I think even just as much as the information is being churned out regarding the virus, even guidelines and policies are being refined every other week. And that particular one of testing members of staff of the community pharmacies is quite a controversial one, because people get into close contact with clients or customers or patients. And some of these clients or customers sometimes have their own personal attributes, not necessarily conditions, but attributes. Some of them want to get close based on how private they feel that conversation should be, or whatever items they are buying, or they could even have hearing problems or other forms of disabilities, whether it's the intellectual disability or other forms that might require closer contact and longer times of engagement, which again puts people at risk, yeah, because one of the problems or one of the issues that we are experiencing in community is the use of face masks. So people are now wearing face masks for purposes that they come with penalties if you're not wearing the face masks, and not necessarily that it actually reduces transmission risks. And unfortunately, some of these things are also seen among people who are working in some of our pharmacies. And this, I would say, is wearing masks around the mouth and leaving the nostrils open. And we are all aware that it's the respiratory tract that is the route of, is a port of entry and exit. And we just need to keep, I think, refining our communication and encouraging people to take and abide to the guidelines. Those that are, another question here, chronic illness, such as diabetes and other forms of illness that require medicines with cold chain supply. How is that being handled, or how best should that be handled in the, the delivery persons or businesses that are doing purely delivery of medicines and outsourcing? Because, right now there are all these apps that are out there, and if you Google them on the net, they say that they can actually supply anything. You just need to ask them where to go and get whatever they need, whatever you need. How are we able to ensure that this does not encroach into pharmaceutical products and still maintain the integrity of drugs that require cold chain, as well as achieving what we want, which is a desired therapeutic outcome?
I think I'll answer that from a retail pharmacy point of view, is that anything being delivered with cold chain, we have these little bags which are controlled temperatures, and the little ice pockets which we put in them as well. And we actually deliver within a time frame of 15 to 30 minutes to the patient. And I believe that should be the practice being followed by everybody. Ordering online, I think whoever does the online ordering through the apps, and they've been using that product, obviously they know it has to come via cold chain. I think that comes down to actually the patient or the client receiving that it's ensured it's come in the proper pack when they've received it. I don't think there could be any control what we can do from our end unless we can get in touch with the app holders and ensure that they're doing that.
Thank you, Dr. Mandeep. I think this is very important. It's very important for everybody who's participating, because sometimes we think about the client and client satisfaction, and sometimes that clashes with practice. Dr. Sylvia also reiterates here, say that regarding home delivery of drugs, this should be done by professionals, not in a pizza delivery kind of way. Guidelines to maintain professionalism should be developed and adhered to. In home-based care activities like history taking, examination, medication, reconciliation, and development of pharmaceutical care plans should be done, not just pick and drop approach. So I think that's very important. Even for those community pharmacies that are, sometimes thinking of cost cutting, I think it's important to identify clearly your delivery service. If need be, that they're actually trained on exactly what they're doing, what they're interacting with, and what it means to the client at their level. Again, information has to be broken down, and that's why effective communication during this pandemic is so important, that everybody understands things in a manner that is expected, in the right way. Dr. Tracy Muraya says, it's a comment, I think, massive public awareness, preferably through Ministry of Health, through effective media channels and community health volunteers, will improve matters in terms of patients providing their information at any healthcare seeking point. There was one other question here by an anonymous person. With regards to quality of health products and technologies, it has been a concern by the retailers, suppliers, and government on the quality of the items sold. It's of great concern since most players are money-minded rather than quality-minded. What measures do you have in place to fight these menace? So again, this is just again.
I could mention.
To this, sorry.
Yes.
Yeah, continue. Peter, go ahead.
Right. Now, I was just saying that some of the, so it is true that the quality of health products and technologies remains a concern. And I think there are quite a number of measures that have already been put in place, have been always put in place, including, from the PPB's point of view as a regulator, and from the whole supply chain of these products, to ensure that the quality of the item is assured all the way till the point of dispensing, and even up to the point of use in many cases. And we have seen this in practice for very many other things, even like insulin and so on and so forth. The guidelines are in place for dispensing, for procurement, for distribution, for dispensing, and even for use are pretty clear about how to ensure that the products are maintained in good quality. The great concern about whether players are money-minded rather than quality-minded is an opinion, and I don't think we can. I don't think we can defeat an opinion. Yes. I mean, my opinion is that they are not, but we can't debate that. But we can only look at the data that suggests whether that is the case or not. And I think there's pretty much a lot of data that's coming out about that. And then measures in place, as we've mentioned, they span a whole range of areas. So it's not necessarily just about the quality of the surgical mask you're getting, but it's basically the quality of the health products and technologies, spanning all the way from the point of importation or manufacturing, all the quality assurance steps that we have learned both in school and also in practice, to ensure that these products are maintained at the kind of quality that's required. And it's all about standards, processes, and related output-based standards, and their adherence to those things.
Thank you, Dr. Peter, for that. I want to thank both of you for taking time again to come and share with us your experiences at COVID-19 in your practice or your institutions or wherever you're working. I just want to mention a few things here. That one, and this touches on people that are operating community pharmacies or hospitals or institutions, those working in academia, that COVID-19 is still there with us. The pandemic has not gone. We are all aware that COVID fatigue is a reality at the moment. COVID fatigue in the sense that people are getting tired of COVID, and we might lower down our guard, even sometimes as professionals. So we need to find ways of reinventing our ability to fight COVID-19. So that includes maintaining and keeping up with the guidelines that are provided by the Ministry of Health, as well as just finding other methods of wellness, because our mental health, I think, is one of the biggest assets that we can use to fight COVID-19, mental health, ensuring that we ourselves, whether we're working in community hospital or other sectors, are okay. Two, something that I mentioned in the last webinar, water, hand washing points. Yeah, we have adopted new ways, whether it's communal or for specific offices or institutions or retail points, where we have vessels that contain water and a small tap where people can wash their hands in soap. We need to remember to replace this water regularly, yeah, because now a lot is changing. The weather is changing, climate is changing, it's getting warmer. So these are also going to be new points of infection if we are not careful. So ensuring that this water is replaced every day, one. Two, that somebody's checking on these vessels to ensure that they're clean and that nothing deposits in there to accumulate dirt and other pathogens, including other things that would take advantage of improperly covered vessels, like mosquitoes. They could be breeding grounds for mosquitoes now that the weather's changed. The other thing is mask wearing. So there's quite a lot of information that is coming out about mask wearing. We are all aware that we need to check on the quality, we need to check on the type of mask and ensure that everybody's wearing masks properly and not wearing masks just to avoid penalties or to sort of comply with certain guidelines. There is a slide that is up there. So the Pharmaceutical Society of Kenya is going to have its 40th annual scientific conference. We are going to have a virtual edition. This is going to take place between the 13th and 16th of October this year. So remember those dates, keep those dates on your diary. We are inviting members to send in their abstracts in digital form to symposium@psk.or.ke. The deadline for abstract submission is Friday, September 15th, which is not far away. So the call for abstract is now open. So we're inviting people to attend this. This is the new normal. We have to keep up with what is going on. Yeah. Otherwise, we end up with a risk of getting extinct from the scientific community. Yeah. And this is also an important platform for people to just come and share. We have a tradition as a society to meet at this point or even earlier. I think usually it's in June, and just share and just remember that this is ours and this is our sector. So we're asking members to support this cause and attend our 40th annual scientific conference, which is going to be a virtual conference. I want to acknowledge the presence of pharmaceutical technologists, nurses, or other cadres who have made it this morning to this webinar. We really appreciate and really don't take this for granted that you're able to come and share with us and support what we're doing. This is part of the many initiatives of the PSK COVID-19 Response Task Force. And I also want to thank everyone who has been able to put this webinar together today. That is my co-moderator, Dr. Silvio Panga. I want to thank Mbao, who has been quite smooth in moving the slides and making sure that everything moves well. And of course, Dr. Mandip Soki and Dr. Peter Nguhiu, our two speakers, and Dr. Daniela Munene, the CEO of the Pharmaceutical Society of Kenya, who has been at the front of making sure that this happens every week. With that, I want to pass on the mic back to Dr. Daniela to close this webinar. Thank you.
Thank you, Mike. The discussion was so lively and the insights from our speakers very applicable. So I want to join you in thanking our speakers for a very insightful discussion this morning. Participants, look out for our next webinar on Wednesday at the same time. We continue with this series of role of pharmacists in managing COVID-19. And we will be exploring and expounding the guidance that is contained in the PSK pharmacotherapy guidelines for COVID-19. So see you again Wednesday, same time next week. Have a good day. Thank you.